Can you louder than that? Yeah, like there. Hello, welcome to the next step. New consciousness programming, showcasing the art, the music, the literature, the spirituality, and the politics of the evolving new consciousness. We're coming to you direct to tape from Palo Alto, California on Sunday, April 21st. My name is Galen, and our show today, the 5th episode, is called Waging Peace in the War on Drugs. I'd like to introduce our panel. To my left, Dale, would you please introduce yourself and tell us a little bit about yourself?
I'm Dale Geringer of California NORML, the National Organization for Reform of Marijuana Laws, which just had its national conference in San Francisco this week. We're promoting bringing pot smokers out of the closet and making it the public aware that pot smoking is as normal, if you will, as drinking alcohol, having sex, any of the other activities that adults engage in. I'm also one of the original organizers of California's Medical Marijuana Initiative, Proposition 215, which has become a battle now between the state and federal government.
Right. And what a battle that is, and we're going to talk about that today. Thank you, Dale. Thank you for being here today. I know it's been a long 3-day conference, and you've been burning the candles at both ends and in the middle, so thank you for being here today. I know it's a little bit of a drive. On my left, Judy Appel, would you introduce yourself and tell us a bit about yourself?
Yes, I'm Judy Appel, and I am with the Office of Legal Affairs of Drug Policy Alliance. And the Drug Policy Alliance, formerly Linda Smith Center, Drug Policy Foundation, is the national organization working to end the war on drugs. So that doesn't mean that kind of starts with ending the multitude of punitive policies that the federal government and state governments are placing on individuals for using drugs, but also redirecting those policies towards more sensible drug policies based on fundamentals of justice and human rights and public health and science.
Logic.
And logic.
I mean, basically logic. I think that's what we need to bring to this debate. Thank you for being here.
And I want to start by also just congratulating you on an excellent conference.
Yeah, very fabulous. I was telling Dale that I've been to many conferences put on by a lot of corporations, and that was probably the best run conference that I've ever been. That says a lot for the people that are in this movement, and it's not a bunch of couch potatoes. On my right, Dr. Fry, would you introduce yourself and tell us a little bit about yourself?
Well, I am a medical marijuana doctor, not by choice, but by circumstance. I basically had breast cancer 4 years ago, and as a result of that, felt it was my right in California to grow marijuana in my backyard. It was my understanding that Dale had done a great job and passed a law that was really going to work. And when the police showed up on my door, my husband, who is an attorney, and I were shocked and surprised. And when they persisted and said that they were going to arrest me, I was overwhelmingly angry. And when they left, they insinuated that it would be okay for myself to use marijuana because clearly I was one of those people, but that all the other people in California would not have access to this law. And as a physician, I looked at the law and realized that it names me, a physician, to make this decision for my patients. And that even though I'm still fighting the cancer, I've gone back into evaluating patients as a consultant to try to help them decide if the law applies to them, and more importantly, if we can keep them out of jail. Because the biggest harm to anyone from using cannabis is incarceration.
Right, yes. And just a little aside here, this is the way the universe works, of course. Dr. Fry is the doctor that wrote my medical marijuana prescription. I'm a medical marijuana user. If I could just tell my story just briefly, just to set the stage for this as well, is that I had back pain for 5 years. It was excruciating. I'd wake up every night, 3 in the morning, back pain. And I had stopped smoking ganja since, well, my preferred term for it, ganja, because it's a sacred thing. It's now part of sacrament for me. And this was, I found, the only thing that helped and totally alleviated the back pain. I went to the back for doing yoga and karate, and otherwise I'd be a wreck waking up at 3 in the morning and not be able to go back to sleep. And I was arrested for that as well. So I think we all have marijuana stories. So I'd just like to throw out just a general topic. The marijuana laws are curious because there seems to be there's so much to it. It's a octopus. There's so many reasons. I learned about a new reason the state seems to be arresting marijuana users is because they're great labor in the prison industrial complex. So how do we sort through this complex maze, and what are the strategies? Can we talk a little bit about normal strategy in this? I know you have a strategy.
Our strategy, well, I think our biggest obstacle at the moment is the fact that most marijuana users are invisible. We're in the same place that the gay rights movement was 30 years ago. Everybody in America knew all sorts of gay people, and they didn't know that they knew them. The only gays they knew about were the ones who got arrested in the men's bathroom or something like that. And then it took an active movement of gays coming out and making themselves public to really make the public comfortable with tolerating homosexuality. And we are at the beginning stages now of the campaign to try to bring out many of the well-known in the closet pot smokers in society.
Well, Bill Maher did that on Saturday. I like that.
Bill Maher is not in the closet
No, he's
himself.
not in the closet. He brought a couple people out.
And there are a few other illustrious people out there, like Willie Nelson or director Robert Altman. But there are many, many others who are afraid to say anything at all, at least until we get a critical mass of people who are willing to go along with them. We're working on that now.
Right. I think there's definitely wisdom to the old adage, there's safety in numbers, and I think that's overall strategy that we should be using is, Matt, one of the things I'd like to address to Judy is, I wonder why this hasn't been challenged more in the courts. I mean, here are laws that that are actually more damaging than the supposed crime that they're there to prevent, like, there's an insanity to it, and why haven't legal strategies worked to this? Like, what has been tried, what works, what doesn't work? Where are we on that?
I think it's a good question, and it's a broad question, a difficult question, but I wanted to actually respond to something that Dale said, because I think the coming out of the closet is one piece of it, but I also think that the public opinion piece is another big piece of it. And
well, the coming out of the closet affects that too.
Right, and they're linked into one another.
Together,
and we have a situation here where, I mean, every single common sense, our own knowledge, everyone's experience, as well as really well-respected polls almost everywhere show that the vast majority of the public support, at the least, legalization of medical marijuana across the board, no question, in almost every state where it's been tested. And yet you have this discord with particularly federal laws and to some extent, the state laws, but certainly with federal law enforcement and the federal enforcement. So I think that's another piece we really need to be looking at. A piece of it is certainly the coming out of the closet, but another piece is people already know that this makes sense.
Well, yeah, but people didn't get arrested for saying they were gay. They might have lost their job, and the rare one might have gotten beaten up, but they didn't have the power and the might of the federal government raising its energy.
Well, I feel that this I'd be curious to hear what you all think about this. I think that the war on drugs is actually the pinnacle, or where the tire meets the road on a much broader question, and that's this question of fascism. Our last show is called The Fall of Fascism, and you may or may not agree that this is getting close to fascist or whatever, but this issue is really where the tire meets the road.
Well, I'm sorry, I was just going to say, I find this entire thing so absurd from a medical point of view, because the truth is that drug addiction, you either understand intellectually and emotionally that drug addiction is a disease, as alcoholism is a disease, and you treat it as though it was a disease, and you design treatment for either maintenance strategies if you cannot cure the disease, or curing the disease in the sense that they are able to go to less toxic, harm reduction drugs and retain their ability in society. In the 1900s, and this will sort of kick off where we're going, all drugs were legal. You could buy heroin, you could buy cocaine, you could buy whatever. And they did a study on the percentage of people who were in trouble with drug abuse. In other words, if they didn't get their drug, they went into withdrawal. That percentage was approximately 5 to 10% of the population.
When so those 5%, 10% were addicted.
Were actually addicted.
Physiologically addicted.
Well, I've heard different numbers, but the point is, in 2000, that number was the same. So the billions of dollars of war on drugs has not changed the addiction rate. But the significant difference is when all those drugs were legal, those men and women went to work and supported their family. Now that all those drugs are illegal, they are in jail or they're committing crime to attain the money necessary. I, as a physician, can prescribe heroin for an addict for roughly $5, what it takes them $500 to buy on the street. So if you were to take it as a illness and put it in the hands of trained professionals, you could probably completely wipe out the black market.
I just want to treat the addiction to it as an illness, because when you start talking those kind of terms, it's not treat the use as an illness. The use of these things, even as something, I mean, I understand that heroin's very addictive, but I'll admit, I'll go on camera and admit that when I was in India, I smoked opium, and I smoked opium for 2 weeks, and I was not addicted to it.
Well,
I'm not smoking it now, you know.
I mean, but I don't think I don't think it's even important or the point to say or to try to propose that addiction to drugs or misuse of drugs in our society doesn't create some problems in communities, and particularly poor communities and communities of color. I don't think those problems begin to address the level of problems that the war on drugs causes in those same communities.
Exactly.
But the point is that
they're resource consumption.
And they're entirely different questions.
Right.
The question is what, it's one of cognitive liberties, it's one of human rights, and it's one of common sense. Where are we going to put our money?
I think Molly raised a very good point about all drugs having been legal actually in the lifetime of my grandparents.
Right, exactly.
And I've spent a lot of time researching that. And you read the newspapers from around the turn of the century, all drugs are legal. You see almost no story